एक्सटर्नल केफालिक वर्जन. एक्सटर्नल केफालिक वर्जन होता क्या है इसमें? fetus is drawn to the cephalic presentation by manipulation through the maternal abdominal wall. ओके. सक्सेस रेट क्या है? मल्टी पैरस में इसका सक्सेस रेट 60% है और नली पैरस में इसका सक्सेस रेट 40% है. इंडिकेशन क्या है? कोई भी आपके पास पेशेंट अगर प्राइमरी कैविडा है वो प्रेजेंट करती है ब्रीच प्रेजेंटेशन के साथ एट 36 वीक्स, और मल्टी ग्रेविडा है और वो प्रेजेंट करती है ब्रीच प्रेजेंटेशन के साथ एट 37 वीक्स. ठीक है. एंड देर इज़ no contraindication for the vaginal delivery, then we will go for the external cephalic variant. We have to rule out all the contraindications first. Contraindications are subdivided into absolute and the relative. In absolute contraindication, number 1 is condition when already cesarean section is planned. As previous to cesarean section का आपने सेक्शन करना ही करना है, तो there is no chance for external cephalic version. Okay. If multiple gestations, then we can't do this. And if there is antepartum hemorrhage in the last 7 days, if there is uterine abnormalities, if there is abnormal fetal heart rate, placental abruption, ruptured membranes, and onset of labor, in this condition we will not perform the external cephalic version. There are some relative conditions like IUGR on Doppler studies, proteinuric preeclampsia, previous scarred uterus, unstable lie, oligohydramnios, dead and malformed baby, or other like precious pregnancy, grand multiparity, obesity, polyhydramnios, and good size baby. These are contraindications, but these are relative. Okay, success rate of the ECV ranges from 30 to 80%, depends upon the race, parity, uterine tone, volume, engagement of the breech, whether head is palpable, and the use of tocolysis. Spontaneous retroversion of the breech is after successful ECV is less than 5%. Female with a breech baby should be informed that आपने उसको इन्फॉर्म कर देना है कि अगर हम ECV कर देंगे तो सीजरियन सेक्शन का जो रेट है वो कम हो जाएगा. जैसे कि हमने देखा है कि सक्सेस रेट जो है वो 60% मल्टी ग्रेविटी है और नली पैरस में 40% है. देन अगेन इंडिकेशन ब्रीच प्रेजेंटेशन, oblique lie, and the transverse lie. We have to maintain some prerequisites for this. Number 1 is abdominal wall should be thin and relaxed. यूट्रस नीदर टेंस और नॉट इरिटेबल होनी चाहिए. आपके पास यूट्राइन अल्ट्रासाउंड असेसमेंट हो फॉर द लाइकर, प्लेसेंटल लोकलाइजेशन, confirmation of the breech and attitude to the fetal head, and uterine and fetal anomaly exclude कर लें. Breech should be unengaged. Theatre should be available, anesthetic and the pediatrician should be available for the emergency cesarean section. CTG should be reactive and the bladder must be empty. These are the prerequisites before carrying out the external cephalic variant. Now come to the procedure. First of all, you have to introduce the patient and explain the procedure and explain all the complication and tell about the success rate and take an informed consent. Fulfill all the prerequisites and ask the patient to rest on the couch and identify the fetal back and hold the breech in the right hand and the fetal head in the left hand, and apply sustained pressure on the both hands simultaneously in the direction which promotes the flexion and keeping the head flexed. Okay, pressure should be must be sustained for at least 2 to 5 minutes, but make sure that the pressure must not be maintained greater than 10 minutes. And in between this procedure, you have to check the fetal heart rate at every 2 minutes. After successful version, attitude to the fetal head should be maintained for few minutes, so that it must be fixed for that. Post-procedure management. What will be the post-procedure management? Number 1, fetal condition should be assessed with the CTG for 20 to 30 minutes. Patient should be washed for 20 to 30 minutes for uterine contractions. Give her sterile pad and observe for any vaginal bleeding, leaking. If the mother is RH negative, give the NTD. If everything is satisfactory, patient can be discharged on the same day and should call for the follow-up of 1 week to review and the plan further. What complications of the ECV can happen? Number 1, fetal distress, rupture membrane, preterm labor, fetal trauma, cord accidents, placental abruption, fetal-maternal hemorrhage, and the uterine rupture. Uterine rupture, 0.5% of the and in the emergency cesarean section. If one attempt fails and we ask the patient to follow up after 1 week, and then procedure can be repeated after 1 week. Procedure can be painful and it should be stopped if patient wants to stop it. Thank you.